Quick question, and be honest with me right now. After you brush your teeth, do you grab that fancy blue bottle of mouthwash, or do you just swish some plain water around and call it a day? Most people think they already know the answer to which one is better, but here's the thing. I've spent the last few weeks diving deep into actual dental research, talking to professionals, and what I found genuinely surprised me. Because one of these habits might be quietly undoing the work your toothpaste just did. And no, it's not what most people think. Stick with me for the next 10 minutes, because by the end of this video, you are going to walk away with clearer, more confident choices about your oral health. Choices that are actually backed by science, not just by a cool-looking commercial. If you're new here, we make complicated health topics simple, real, and actually useful for your everyday life. Today, we are breaking down mouthwash versus water rinse. Let's get into it. Section 1. Setting the stage. Why this debate matters. Before we dive into pros and cons, let me give you some real context, because this is not just a random topic. According to recent market research, the global mouthwash industry is worth over $7 billion as of 2024. $7 billion. That is a massive industry built around a 30-second habit. At the same time, dentists and researchers have been having an ongoing conversation about whether that habit is always beneficial, or whether in some cases, plain water rinsing is not only just as effective, but actually healthier. That tension right there, that's exactly what we're exploring today. And to keep things organized, we're going to look at both options through 4 lenses: what they do, what science says, who benefits from each, and some situations where one clearly wins over the other. Sound good? Let's start with mouthwash. Most of us have been using mouthwash since we were kids, or watched our parents use it. But do you actually know what's in it? Mouthwash is not a single product, it's a category, and there are 2 main types. Number 1, cosmetic mouthwashes. These are designed to freshen breath temporarily. They mask odor, that's basically it. No real therapeutic benefit beyond making your breath smell better for a few hours. Number 2, therapeutic mouthwashes. These are the heavy hitters. They contain active ingredients, things like fluoride, chlorhexidine, cetylpyridinium chloride, or essential oils like eucalyptol and frymol. Now here's where it gets interesting. Each of these ingredients does something specific. Fluoride strengthens your enamel. Chlorhexidine, which is prescription only, kills bacteria aggressively and is often recommended after oral surgery. Essential oil blends reduce plaque and gingivitis, and some mouthwashes contain hydrogen peroxide for whitening. So mouthwash is not just flavored water, it's a complex liquid with real chemistry behind it. But does that make it better? Let's talk pros. Section 3. Pros of mouthwash. Pro number 1. It reaches where your brush and floss can't. Your toothbrush covers about 25% of your mouth surfaces. Floss handles the in-between spaces. But mouthwash? It flows into every corner, every crevice, every pocket around your gums. That kind of coverage is genuinely hard to replicate with anything else. Pro number 2. It reduces plaque and fights gum disease. A 2023 review published in the Journal of Periodontology confirmed that using therapeutic mouthwash consistently as part of a full oral care routine significantly reduces plaque levels and early-stage gingivitis. This is real, peer-reviewed science, not just a TV commercial. Pro number 3. Fluoride mouthwash protects your enamel. For people who are cavity-prone, or for teenagers with braces, fluoride rinse can add a protective layer that makes a measurable difference. The American Dental Association actually recommends fluoride mouthwash for high-risk patients. Pro number 4. It helps manage bad breath on a deeper level. Cosmetic mouthwash just covers odor, but antibacterial mouthwash actually targets the odor-causing bacteria at the source, specifically the anaerobic bacteria that live at the back of your tongue and below your gum line. Pro number 5. Post-surgical and medical use cases. After tooth extractions, gum procedures, or for patients with dry mouth conditions, specific mouthwashes are prescribed because plain water simply doesn't have the therapeutic capacity to protect healing tissue or manage bacterial load. Okay, so mouthwash sounds like a superstar, right? But before you run and grab a bottle, we need to talk about the other side. Section 4. Cons of mouthwash, the side you didn't see coming. Con number 1. Alcohol-based mouthwash can dry out your mouth. Many popular mouthwashes, especially the ones with that intense burning sensation, contain alcohol levels between 18 and 26%. And here's the problem. Alcohol is a drying agent. A dry mouth means less saliva. And saliva? That's your mouth's natural defense system. Less saliva actually means more bacteria over time, the exact opposite of what you want. Con number 2. It can disrupt your oral microbiome. This one is really important, and it's only becoming more understood in recent research. Your mouth contains a complex ecosystem of bacteria, some harmful, yes, but many are actually beneficial. They help control pH, fight pathogens, and even play a role in your cardiovascular health. A 2023 study from University College London found that frequent use of antibacterial mouthwash altered nitrate-reducing bacteria in the mouth, bacteria that are directly linked to healthy blood pressure regulation. That is wild. Con number 3. Rinsing right after brushing washes away fluoride from your toothpaste. This is a big one. The NHS and multiple dental associations have updated their guidance to say do not rinse with water or mouthwash immediately after brushing. Why? Because you wash away the concentrated fluoride that your toothpaste just deposited on your enamel. If you're using mouthwash, use it at a different time, like after lunch, not right after your morning brush. Con number 4. Overuse can cause staining. Chlorhexidine mouthwash, while powerful, is known to cause brown staining on teeth and tongue with extended use. It's effective, but it's meant for short-term therapeutic use, not a daily forever habit. Con number 5. It gives a false sense of security. People who use mouthwash sometimes reduce their brushing and flossing efforts because they feel like their mouth is clean. The swish and burn makes it feel thorough. But mouthwash is not a replacement for mechanical cleaning, it's a supplement. Alright, now let's flip to the other side, because plain water rinsing has some legitimate science behind it too. Section 5. Water rinsing. Simple, but don't underestimate it. Water rinsing feels almost too simple to take seriously, but science has some genuinely interesting things to say about it. Let's talk pros first. Section 6. Pros of water rinsing. Pro number 1. It's the safest rinse after brushing. Remember what I said about fluoride? Rinsing with water right after brushing is still better than rinsing with mouthwash in terms of disruption, but ideally, you should spit and not rinse at all immediately after brushing. If you do need to rinse, water is the least disruptive option. Pro number 2. It physically removes food particles and debris. A water rinse after meals does something simple and effective. It dislodges food particles from between teeth, reduces acid exposure from sugary or acidic foods, and helps restore your mouth's natural pH balance. Studies show that rinsing with water after meals can reduce cavity risk measurably. Pro number 3. It preserves your oral microbiome. Unlike antibacterial mouthwash, water doesn't indiscriminately kill bacteria. It cleans mechanically through force and hydration without chemical disruption. For people with a healthy oral microbiome, this is actually the gentler, smarter option. Pro number 4. Accessibility and cost. Let's be real, clean water is free. For millions of people, especially those managing tight budgets, a consistent water rinse habit is a genuinely practical and effective oral health tool, and it has zero side effects. Pro number 5. Hydration benefit. When you rinse with water, even if you don't swallow much, it stimulates saliva production. More saliva means better natural bacterial control, better digestion, and better breath over time. Section 7. Cons of water rinse. Con number 1. No therapeutic action. Plain water cannot kill bacteria. It has no fluoride, no antibacterial agents, no anti-inflammatory properties. For someone dealing with gingivitis, cavities, or gum disease, water alone is simply not enough. Con number 2, it doesn't address deep bacterial buildup. The bacteria colonies living in your gum pockets and on the back of your tongue are pretty well protected. Water doesn't reach them effectively enough to reduce their populations in any meaningful clinical way. Con number 3, no breath freshening compound. While water helps rinse food residue, which is one cause of bad breath, it does nothing against the sulfur compounds produced by bacteria. If you have chronic bad breath, water rinsing alone won't solve it. Section 8. Head-to-head comparison. Who wins? Okay, so let's put them side by side for a moment. For cavity prevention, mouthwash wins, specifically fluoride mouthwash. For gum disease treatment, mouthwash wins again, with therapeutic formulas. For post-meal rinse, water wins. Simple, effective, no microbiome disruption. For right after brushing, honestly, neither. Spit and leave the fluoride on your teeth. But if forced to choose, water causes slightly less disruption than mouthwash. For daily long-term use, water, with periodic therapeutic mouthwash when needed. For people with dry mouth or sensitive tissues, water or alcohol-free mouthwash only. For kids under 6, water rinse only. Mouthwash is not recommended for young children. The real takeaway here is this isn't about one being universally better. It's about knowing when and why to use each one. Section 9. Expert positions and what dentists actually say. Let me give you the consolidated expert position on this as of 2024 and 2025. The American Dental Association says mouthwash can be a helpful adjunct to brushing and flossing, but it is not a substitute. They recommend looking for the ADA seal of acceptance when choosing a therapeutic mouthwash. The NHS in the UK updated guidelines to say use mouthwash at a different time than brushing, not immediately after. Periodontists, gum specialists, generally recommend antibacterial rinses for patients with active gum disease, but caution against making it a permanent daily habit without dental guidance. And increasingly, holistic dental researchers are pointing toward probiotic mouth rinses as the next frontier, rinses that actually add beneficial bacteria rather than destroying everything. That's a space to watch. The bottom line from science and dental professionals: build your routine around brushing and flossing first. Use mouthwash strategically, not reflexively. And rinse with water after every meal. That one's free and effective. Section 10. Audience engagement segment. All right, real talk time. I want to hear from you. Drop in the comments right now. Are you team mouthwash or team water rinse? And after watching this video, are you rethinking your routine at all? Also, if you've been rinsing with mouthwash immediately after brushing this whole time, first of all, you are not alone. A lot of people do this, but now you know better and you can change it starting tonight. One thing I want you to take away from this channel, every single video, is that small, informed changes in your daily habits create massive results over time. Your oral health is directly connected to your heart health, your gut health, your sleep quality, and even your mental clarity. Taking this seriously is not vanity, it's self-care at a foundational level. If this video helped you, do me a favor and share it with someone who still thinks mouthwash replaces brushing, because we need to save them. Outro. Thank you so much for spending this time with me today. Seriously, you choosing to watch educational content like this instead of mindlessly scrolling means something, and I appreciate every single one of you who's building that habit. Next week, we're covering something that a lot of people have questions about: floss picks versus traditional floss. You don't want to miss it. Until then, drink your water, protect your smile, and I'll see you in the next one.